People are not aware that pills that go around being sold as things like Adderall or Xanax or pain meds are not what they say they are. They are, in fact, potentially a counterfeit med that looks like anything but is potentially containing fentanyl.
Agencies throughout Lane County fighting to save lives from fentanyl overdoses. They say it takes the entire community to get drugs off the streets. It's a man-made opioid often used to treat pain, but fentanyl is highly addictive and having a deadly impact in Lane County. Still, local police departments believe ramped-up enforcement efforts from this year will show a change in overdose deaths for 2024. NBC 16's Gold Meadows has more.
Lane County Public Health has been tracking fentanyl overdoses since around 2019 and tells us just a couple milligrams is a lethal dose.
A crisis. Very much a crisis. Each and every year in Lane County and in Oregon, we see more deaths since 2020. 2024, we're still out to see what the numbers, if they've changed, but we know in 2023 we broke the records of the previous years. It hit the 200 mark and went above in Lane County for people that lost their lives, likely due to fentanyl.
According to LCPH, Eugene and Springfield are hardest hit for the county. Law enforcement in both cities are actively working to put a stop to the problem with the help of the Drug Enforcement Agency along with Oregon State Police.
This year we've responded to 160 or 161, I think, calls for service involving overdose.
Roughly 90% or more were fentanyl related. In Springfield, deaths from overdose are trending slightly lower than last year. Lieutenant Myers attributing this to over-the-counter access to anti-overdose medication Narcan and public awareness. Still, the fight continues. SPD has seized roughly 10 pounds of the opioid in targeted drug enforcement cases. A single pound could lead to 100,000 plus overdose deaths. Another boost in finding the drug, staffing changes for SPD, which dedicated an officer and narcotics detection K-9 to the effort.
I'm working with our DEA partners on a task force to focus on kind of the high-level narcotics cases, interstate, trafficking and those types of cases. We've also recently started a crime reduction unit.
The previous decriminalization of small amounts of drugs with Measure 110, followed by recriminalization, is now meeting newer officers not familiar with low-level possession cases, which means ramping up training. Officer Brad Hanneman, who works on the Eugene Police Department's Street Crime Unit, says overdose deaths in Eugene are also at a low point, but seizures are on the rise with 30 pounds of fentanyl seized so far this year.
It's still happening through transit on the interstates. We're a high traffic, or we would be considered in Eugene a HIDTA zone, which is high intensity drug trafficking area.
EPD says their cases are highly reliant on community members who take the risk to report what they see.
About 95% of our cases are developed through human intelligence. And that can be from a tip, that can be from a source, an informant.
SPD encourages the reporting of both fentanyl and overdoses. They say even those who report an overdose are protected by the Good Samaritan law, which means they would not be prosecuted for being in the presence of the drug in an effort to save a life. Reporting in Lane County, I'm Gold Meadows.
Thank you, Gold. Public Health says harm reduction, access to Narcan, and test strips help, along with access to treatment, recovery, and education for young people. They're all valuable in fighting overdose deaths. Their fentanyl-aware Lane County program also visits schools to prompt community conversations over the drug.